So good evening, everyone. I'm Dr. Sushma Jaiswal. So there's a slight change today. I will be moderating this session. So we present you Dr. Jagose. So for us, I've always seen him as, a very stern teacher on the editorial board. But when I was going through his profile, I was so amazed. I was not shocked, but definitely amazed. And to the kind of credentials he has, I had to actually write down because I was thinking, I would be on screen and just saying, but it's very difficult to actually remember what all he has done his entire career. So Dr. Jagose, he has been practicing homeopathy since 32 years. He's been on our editorial board since, I think, the beginning. In 1992, he was the only doctor to receive a travel scholarship from Mommy Academy, USA. And he has, it was for advanced training in homeopathic workshop way back in 1992. He is attached to Dr. D.Y. Patil College, Medical College, Pimpri, as a professor in Department of Organon and Homeopathic Philosophy. He has presented various scientific papers. He has authored many books which have been recognized by MUHS. He is a teacher, examiner for postgraduate students in India, not only in India, but also Malaysia. And he is also an inspector, chairman for local inquiry committee for CCH India. He has been awarded various awards, and few one I would like to name is Bharat Ratna Mother Teresa Gold Medal Award from GEPRA, and he has been conferred with Star of Homeopathic Award in 2019 from University of West London. Dr. Jagose, I would like to invite you for this interesting session on one-sided disease. Over to you, sir.
Well, thank you very much, Dr. Sushma. And I will share my screen right now. So today, our topic is one-sided diseases and its homeopathic management. So this topic has been taken because it's really difficult to prescribe when few symptoms are available. So we have to go according to our great master, Dr. Samuel Hahnemann, his directions as given in Organon text in order to be a successful homeopathic physician. So one-sided diseases, as you all know, it is given in aphorism number 172 and it extends right till 230. Now, as you all know, one-sided diseases is divided into physical cause, the physical disease, as well as the mental disease. The physical disease is divided into internal as well as external. External is then further subdivided into one-sided malady and one-sided disease. So I'll be dealing with the internal kind of the one-sided disease. So let us see one case which will explain to you in a very nice fashion how I came to the simillimum according to the directions of the Organon. So, Mr. RBK, 47 years old man, a known alcoholic and a lower class laborer by profession, came to me on 4/5/2004 with the chief complaint of abdominal pain since the last 4 years. He was investigated and was diagnosed as a case of biliary calculi associated with chronic pancreatitis, generalized gastritis, and duodenal erosions. The patient was admitted practically every month in the hospital for the same complaint since the last 10 months. And the patient opted for homeopathic treatment as he was fed up by recurrent hospitalization, which offered him only temporary relief. And furthermore, he was also advised an operation to remove the gallbladder, but he refused because he was quite poor and he couldn't afford the fees. Homeopathy history was elicited by my assistant doctor. The onset was sudden with intense colicky type of pain in the right hypochondrium, epigastrium, and the umbilical region. It was associated with nausea, which was aggravated in the morning. Later on, it was followed by vomiting of white watery matter which was aggravated by the slightest intake of food or even water. An important concomitant of backache was also ascertained. Past history, similar complaints 4 years back. History of ascites 3 years back, was hospitalized, and history of piles 3 to 4 years back. Well, in the family history, nothing significant was ascertainable. In the personal history, appetite was good. His thirst, he had a thirst for around 70 glasses of water per day. Urination was normal, defecation twice a day. Perspiration profuse all over the body, non-staining and non-offensive. He craved for alcohol. He had a great aversion to milk. Sleep was disturbed many a times. Dreams were quite non-specific. He was a chilly patient. Habits was alcohol intake and cigarette smoking in abundance in the last 20 years. And he has claimed that he has stopped taking alcohol. That is why I got a question mark, because I could not, take him for his word. The personal history, on the mentals, it was difficult to elicit the mental history because he came from a low socioeconomic status, and he wasn't well aware with the homeopathic concept of case taking. And furthermore, he was also illiterate. So my assistant doctor tried to elicit only a few symptoms. So in the initial interview, we only got that he was very shy and he was an introverted personality. He likes to travel and he had a good memory. That's all. Nothing much more could be appreciated on the mental level. On examination, the examination of the abdomen, we got tenderness in the right hypochondrium, epigastric, and the umbilical region. And the USD report on 27/4/2003 revealed gaseous distension of the abdomen with gallbladder calculi 12 millimeters in diameter and enlarged pancreas with irregular contour. Esophageal gastroduodenoscopy showed moderate to generalized gastritis with duodenal erosions, and he had a raised serum amylase also. Here you can see the gallbladder and stone out here. In the report also, as you can see the circles in red, a 12 millimeter stone size seen in the gallbladder. Thus, taking the history into consideration with the examination findings and the lab investigations, it was concluded that the patient was suffering from a one-sided complex disease. So not only it was one-sided, but it was also a complex disease of chronic pancreatitis, gallstones, generalized gastritis, and duodenal erosion. So as you can see, it's quite a complicated case with not only a double complex disease, but there are basically 4 complex diseases in this person. And of course, which was one-sided in nature. It was one-sided because the symptoms were too few. If you see our organ on definition in 173 aphorism, it has been given that one-sided diseases are those diseases which exhibit only 1 or 2 principal symptoms and they obscure almost all the others. They belong to the class of chronic disease and are general psoriatic in origin. So in this case also, we are only getting a few characteristic symptoms to prescribe on. Well, analysis of the case. In this case, the problem encountered was that the patient was illiterate and it was difficult to elicit the history, especially the mental symptoms. And my assistant doctor tried her level best to elicit the symptoms in the case, but we could only get very few symptoms. I also tried to probe deeper into the case regarding the mentals and the patient's life situation, but in vain. The patient was only interested in getting better and did not lay any importance to any other questions asked. So time and again, when we used to ask him questions, he should just say that, please make me better. I'm not bothered about all the other kinds of questions which you are going to ask me. So hence, in this tricky situation, I had to rely on what symptoms were elicited. And initially, my goal was to offer some relief to the patient in order to gain some confidence in him that homeopathy works. Because he was referred by some other patient, and he had come with great hopes. So I did not want to let him down. So the evaluation of the case, it was done according to the Hahnemannian philosophy, which made it a complex case with a few characteristic symptoms. It naturally belonged to the class of one-sided disease of an internal kind. And the phase also was a one-sided, slow progressive chronic phase. in the totality, so whatever symptoms we had got, the totality was elicited, that is shy, craving for alcohol, aversion to milk, intense colicky type of pain in the abdomen, nausea in the morning, and vomiting a white watery matter aggravated by the slightest intake of food or water, and an important concomitant of backache. So Homeopathic software was used and Kent's repertory was taken, and the following rubrics were taken, which you can see on the screen. And the important concomitant symptom of backache was taken as an eliminating symptom. So it was repertorized and many drugs came out, but the most similar drug was Nux vomica, which covers up even the important concomitant symptom of backache. So Nux vomica was the remedy to start off with. It was given in the 200 potency in the centesimal scale, as successfully was moderate, and it was naturally repeated 3 times a day for a period of 7 days. Now let us see some important materia medica as to why I chose Nux vomica. If you read Kent's lectures, it has been given that aggravated by meat, crave stimulants, pungent, bitter, craving for pungent things, bitter things, milk, sours on the stomach, bad effects of coffee, alcoholic drinks, debauchery, and stomach symptoms like pulse worse in the morning. And when the stomach is sick, it will empty contents with no great efforts ordinarily. But in Nux, there's a retching and straining, as if the action would go on the wrong way, as if the abdomen, as if it would force the abdomen open. A reversed action, retches, gagging, strains. After prolonged effort, he finally empties the stomach. In Allen's keynotes, again, bad effects of coffee, alcohol, tobacco, mind, anxiety with irritability, stomach, sour, irritation, nausea. And if I could only vomit, I would feel so much better. That's very important of Nux also. William BOERICKE also desires stimulants, want to vomit but cannot, sour taste and nausea in the morning, aggravated after eating. Then A.C. COWPERTHWAITE shows nausea in the morning and crawling, cramping pains in the stomach. So, as you can see, many books were referred and Nux vomica was taken. And it was given 3 times a day for a period of 7 days. Well, in the follow-up, patient felt slightly better. The abdominal pain and vomiting was reduced in intensity. So, since he was better, we continued the medicine TDS for a period of another 15 days. Follow-up showed not much improvement with recurrence of symptoms which were previously better. So, whatever symptoms have disappeared along with Nux vomica, they again used to resurface up after a brief period of the patient feeling better. So, this made me think as to why this had occurred. So, according to Kent's 12th observation, this type of remedy response falls into the 5th type of response, wherein amelioration is where there is amelioration first and then comes aggravation. So what is the inference of this observation? It indicates that the case was not taken properly and or only superficial symptoms were taken into consideration. Basically, the in-depth study of the case was not done or it was lacking. So this made me realize my mistake, and once again I tried to elicit more symptoms to make the totality clear. So as you all can see, it's a one-sided disease exhibiting only 1 or 2 principal symptoms, difficult to get the rest of the case because in the periphery or at the background, the symptoms were not very clear. They were incomplete, they were hazy, they were ill-defined. So we had to now go into the case and try to see if I could elicit still more symptoms which could help me to prescribe. So my assistant doctor and I tried hard to convince the patient to answer correctly and to cooperate with us if he wanted to get better. So each time he came for the interview or for the follow-up, he always used to come alone. So this did not yield any fruitful result, as the patient only used to answer either yes or no to the questions. So in monosyllabus, he used to answer yes or no, that's all. So he wasn't very cooperative also. So during the process of interrogation, he was constantly asking me time and again if he would get better, and also wanted reassurance of the same. On further integration by his son, so one day it so happened that his son also accompanied him. So I asked the son if you could tell me some more symptoms or whatever you feel about your father. So he said, of course, that he likes company, he has many friends, but he doesn't like to stay alone. And there was a great fear of darkness, and he always wanted a small light in the room when he slept at night. So even if there were other people in the room sleeping with him, if the room was pitch dark, he could not get sleep. A small little night lamp was always there because he had the fear of darkness. So this is what the son told me. And of course, the son also could not give me more information besides this. So the totality was revised. So I took into consideration fear of dark, lies, company, shy, and the remaining totality which I took previously. Rubrics taken, as you all can see on the screen, which I've taken here, and I repertorized it. And as you can see, calcarea, pulse, nux vomica, sepia, phosphorus, carbohydrates, lyco, sulfur, arsenic, strontium, so on and so forth were there. But we closed the case on phosphorus. Why? Let us see. So the constitutional remedy was phosphorus. So as you can see, initially only 1 or 2 principal symptoms were there. Nux vomica was given. Patient was not so much better. We again tried to probe into the case, and we found out some symptoms which could be of use, and we retook the case, retook the totality, and we came to another conclusion of the remedy phosphorus. Why? Because the symptoms had changed. So in Herring's Materia Medica and Guidance Symptoms, if you see, he writes anxious, filled with gloomy forebodings about termination of his illness. So basically, he was constantly asking me, whether he will get all right or not. Apathy answers no questions or replies wrongly. That means he has to only answer either yes or no to the questions which I heard, which I was answering. Timidity with sensation of fatigue, nausea, and vomiting. Irritability of mind and body, great prostration, anxiety, gloom, forebodings, apprehensive, trembling of the whole body. Indifference or apathy to his friends and surroundings, to his children, answers no questions, takes no notice of his family and things about him. Everything looks dark, he's weary of life, gloom, and says nothing. Then under Kent's, if you go on, he has unquenchable thirst. Water, when the water is vomited, there's always unquenchable thirst. And he always craves for cold food. And there's an intolerable craving for alcohol also. Aversion to sweets, milk, boiled milk, irritation of food, constant nausea, and spasmodic constriction of stomach. William BOERICKE also says great lowness of spirit on the mental level, fearfulness as something was creeping out of every corner, stomach hunger soon after eating, belching of large quantities of wind, and vomiting, water thrown soon as it gets warm in the stomach. In Clark's Materia Medica, again, great apathy, sluggish, dislike to talk, answer slowly or not at all. Then fear in the evening of darkness, of specters, of things creeping out of corners, and ecstasy and throat walking up of mucus in the morning. Stomach nausea of various kinds, spasmodic pain, and drawing pain in the pit of stomach extending to the chest. Abdomen, weak, empty, gone sensation in the abdomen, and it associated with heat in the neck and the back between the shoulder blades also. Allen's keynotes also says, again, a weak, all gone sensation in the stomach, weary of life, longing for cold drinks, cold food, and there is vomiting as soon as the water becomes warm. In COWPERTHWAITE says that again, mind anxious, apprehensive, irritable, and fretful mood, stomach constant nausea. So again, going through the different books, the phosphorus was selected and it was given in the 200 potency. Why? Because there were only a few characteristic symptoms on the mental level and also on the physical general level also. So the prognosis of the case was fair as it was a complex disease and it was with slowly progressing pathological changes. So we were not very sure whether we would be able to relieve the complaints of the patient because it was a borderline case between curability and incurability. The pathology also was slowly progressing and the other maintaining factors like the alcohol intake, which he said he had stopped, but which I doubt very much because it's hard to believe an alcoholic when he says that. So that was also at the back of my mind. So therefore, the prognosis, I had kept it as fair or borderline. Follow-up criteria was that the reduction of the intensity of those presenting symptoms should reduce. And naturally, if the patient felt better, later on, if I would do the investigations, the pathological findings also should show the disappearance of the pathology in the sonography also. So the progress report on 11/5/2004, phosphorus 201 dose was given and it was followed by improvement. After giving that, The patient complained that his complaints were better, his nausea, vomiting was better, abdominal pain was better, even the hospitalization was reduced, but he complained of piles. So this was a return of the original symptoms. As you see in the past history, there were piles 3 to 4 years back, so this surfaced up. Then he was kept on placebo for quite some time, and again, phosphorus 1 m was given because the hospitalization wasn't reduced. So this told me to increase the potency. So 1 m again, 1 dose was given, patient felt better, and there was a dramatic improvement after the 1 m potency. But again, the piles, again, they resurfaced up. So the placebo was continued. This made me think of Kent's 11th observation that of all symptoms are observed to appear, hence placebo was given. So Kent has always told you when there's a return of original symptoms, just wait and watch, give a placebo, it will automatically disappear. Gradually, as time passed, the patient was feeling better with respect to the chief complaints. His hospitalization had also reduced considerably. In fact, now there was no need for any hospitalization also. And his intake of alcohol off and on was there, as he found it difficult to control. Then one fine day he did confess that sometimes or occasionally he still was taking alcohol. So gradual improvement was seen on the subsequent follow-ups with regression of the pile complaints also. So after phosphorus 1 m, we had given a placebo only, and you can see also the pile complaints also went on regressing. Hospital was practically nil. In the month of September 2004, the patient was symptom-free, and he was quite happy that now there's no need of any hospitalization, and he was quite comfortable. So the USG on 25/9/2004 showed mild hepatomegaly, and however, gallbladder, spleen, pancreas, both kidneys and urinary bladder and prostate appear normal. The patient was followed up for a period of 6 months where he enjoyed a good state of health. However, his craving for alcohol was still persisting, and because of which the hepatomegaly was present. Otherwise, I do not see any reason for the hepatomegaly to be present also. So the report of the USG is here. As you can see, the gallbladder is very well defined now. There's no stone out here. And in the comments also, it shows mild hepatomegaly. However, gallbladder, spleen, pancreas, both kidneys, urinary bladder, and prostate appears normal. Out here also, you can see in the gallbladder was visualized and was normal. No evidence of any dilated biliary radicals or biliary calculi or biliary sludge. CBD is normal. So now let me just tell you something about the treatment of the internal kind told by a great master, Dr. Samuel Hahnemann. So in the organ on text, he says that the physician at time cannot perceive the disease in its whole extent with accuracy. So this is also very true because it was a one-sided disease. Initially, when he came, I had only got a few symptoms which I could prescribe on. So the first medicine chosen will be only partially suitable to the case, as there was no considerable number of symptoms to guide to an accurate selection. So therefore, the first remedy in this case was Nux vomica. It was only based on a few symptoms, or rather on the acute symptoms of the patient, because not much symptoms were available, and an important concomitant of backache also was there. So thus the imperfect selection of the medicine due to limited number of symptoms present serves to complete the display of symptoms of the disease. So the Nux vomica was a partially similar remedy because it was only based on the acute complaints, and then the follow-up was taken, as you all saw in the follow-up, that patient was only better with resurface of the symptoms which had again disappeared. So Dr. Hahnemann writes that in this way, it facilitated the discovery of a second, more accurately suitable homeopathic medicine. So I was quite lucky because second time, or in the subsequent follow-up, the patient came with his son, and the important symptoms of that fear of darkness, fear of being alone, and a light in the room has to be there in order to sleep. That helped me to facilitate the next remedy. Thus, the very striking, decided, uncommon, and peculiarity, distinctive or characteristic symptoms will be taken into account in order to analyze the disease in its whole extent. So I was quite lucky. Whatever symptoms I got from the son, they were quite striking, they were quite decided, they were uncommon, and they were characteristic in nature. So it should remember that when the new dose of medicine has exerted action, it will no longer be suitable to the case. So here you could see initially Nux vomica was repeated 3 times a day for a period of practically a month or so, and he was only temporarily better. Therefore, to annihilate the remaining symptoms of the case, another remedy has to be chosen according to the group of symptoms of the case. So therefore, as I told you, Nux vomica wasn't the correct remedy because of the lack of symptoms, or only because of only few symptoms which were exhibited. Later on interrogation, and with by the grace of God as well as luck, the patient had come with his son, which he gave me a few more symptoms. So in this manner, the totality was reconstructed, and in this manner, it should be done until the recovery is complete. So Dr. Henneman says that each time you give a remedy, you have to see whether the remedy was partially similar or it was the similar. So luckily in this case, phosphorus was given, and it was given in 200 potency, which which improved the patient, and 1M with the miraculous result of totally nil hospitalization, and all the chief complaints, including the return of the original symptoms, they had also reduced. So I was quite lucky that I only required 2 medicines, namely Nux vomica and phosphorus. But Dr. Henneman says that in this manner, it should be done until the recovery is complete. That means what? Each time after giving the previous medicine, you have to see whether the totality remains the same or not. If not, if totality has changed, you go on to the next totality and the next remedy. So in this way, you go on treating the patient with different medicines until the patient is completely relieved. So I was quite lucky. I'd only used 2 medicines. Number 1, Nux vomica, which was partially similar, and phosphorus, which was the constitutional medicine. So conclusion, initially the first prescription did not relieve the complaints of the patient, and it was only after retaking the case that the constitutional remedy emerged out, which gave relief to the patient. Here we have to be a keen observer, or else we would not have been able to cure the patient by looking into the remedy response of Kelswell's observation. So that was also very important. We had to properly see what observation the response fell in, and what was the conclusion, and what was your action, which I had already described to you. Therefore, only a proper case recording system will accurately point to the correct constitutional homeopathic simillimum. So whatever case recording system you have, it should be done properly, with accurately, and you have to keep in your whole mind, body, and soul, and take the case. So therefore, our master says a well-taken case is half cure. So use of the repertory will only aid the physician to discover new, rare, and other remedies which we haven't thought of. So basically, if you didn't want to repertorize the case, and if you're quite confident of the totality, you could also prescribe, but repertory will definitely act as an aid to help us to discover certain remedies which we have never thought of. And of course, the repertory is just an aid. The final court of appeal is the Materia Medica. So the Materia Medica alone will be the final court of appeal in choosing the right simillimum for constitutional prescribing. The accurate selection of the remedy, either acute or chronic, will be known through retrospective study of the case after it has been cured or palliated. So this is what Kent has to say. If you read his lectures of Dr. Kent, he has said that the simillimum is the one which you cannot say that in the beginning the remedy what you are giving is a simillimum, because you have to see the response. You have to see how much better the patient is with this remedy. It is only after you have cured the case, that is, after the retrospective study of the case, you can only say that this medicine, what I had given X, Y, or Z, is now the simillimum, because the case has been by it. So this is Dr. Kent's view on simillimum. He differs from all the other authors regarding this. So this is just what I wanted to draw your attention on also. Okay, so that's all, folks. So please do subscribe, follow us on Instagram, Telegram, YouTube, our website, njhonline.com. And also, we also have a YouTube channel. Just type out NJH Journal of Homeopathy or National Journal of Homeopathy. It'll show up. So, and all our videos are uploaded on that. Okay, I also have my own YouTube channel known as Homeopathic Super Sessions by Dr. Jagose. It contains lectures on organon and also important remedies also discussed in daily practice. So if you like my video, please do subscribe to my channel. So thank you very much. Thank you all for a patient listening.